So one of your top priorities has been the Recovery Friendly Workplaces Initiative. Didn't pass on its own, but it came through in the spending bill as a grant program rather than a tax credit. If I own a small business and I want to get involved with the Recovery Friendly Workplaces Initiative, how do I do that, and how much money can I get from the state?
So let's back up a little bit. What Recovery Friendly Workplaces really does is provide tools and resources to local employers within the state to help them understand what's available to them when an employee comes to them and might have an issue with addiction or they're going through recovery. We want to make sure that the employers are not just part of the conversation, but really part of the support system. So there is some money out there, but it's not just about the money we're going to provide to employers. A lot of times it's just the training. What recovery centers are available in your area? How do you keep an employee employed? And at 2.6% unemployment, businesses need to keep every employee that they can. It's better for the business, it's better for the employee. So it's a more profitable operation. It's something that we really started up at Waterville Valley when I was up there prior to being governor, and we're really taking statewide. Now, we had no idea that it was going to get so successful. I think Rhode Island has adopted it. We have national employers that are looking at it on a national scale. So we have some resources coming in. So we have some folks at the state level to help with getting out to the various communities, out to the various employers, letting them understand what this program is all about. I was just up at Hypertherm this morning. They're celebrating their 50th anniversary, and they were the state's first adopter. We now have nearly 30,000 employees working for a recovery-friendly workplace here in New Hampshire. We think all the employers need to take it on because it has been so successful. You know, as an employee, we found that there are employees that are afraid to walk into a treatment center. They're kind of working through their own addiction on their own, but they're afraid to walk in because they're afraid their employer might see them and they might get fired, right? By bringing employers as part of the conversation, people we find are already much more apt to go seeking treatment because they're making their employer part of that process. So it's been very successful. Still a lot of work to do. We're really becoming the national leader. No other place in the country is there anything like this. We have governors calling us all the time trying to replicate the program, and we're going to help them. I really believe very strongly in best practices. But again, this is just one of, I think, many things that can be transformative in terms of fighting the opioid crisis.
You mentioned the drug treatment providers. They just came forward within the last week to say that they need the Medicaid reimbursement rate for substance use disorder services to go up. Otherwise, the state could lose capacity in terms of treatment beds. Why didn't this get resolved in sort of the Medicaid expansion debate over the last year?
So, you know, ensuring that the Medicaid expansion bill went forward was one of the most greatest successes that we've had, because we knew it was one of the biggest challenges, and how that was going to work out, what we could put in there for a work requirement, how much money we could actually save the taxpayer. And we're saving the taxpayer a lot of money, somewhere in the order of $200 million. So it's quite significant, yet no one is losing their coverage, right? That's a model for the rest of the country to take with them, and it's just a function of good management. Now, one of the outcomes there is also we're seeing some of the rates that the federal government will pay are coming down in the treatment centers starting in 2019. So they've come to us. Two things that we're going after aggressively are providing, working with Washington to provide those treatment centers more flexibility in the regulations, because that's actually costing them a lot of money. So by doing that, we think we can bring their costs down a little bit. And there's also time to see what comes in, whether it's additional funds from the federal government, funds in working with the Governor's Commission on drug and alcohol misuse throughout the state, which makes a lot of the recommendations in terms of how the state money is going to be spent. So there's going to be some options in there, and I'm very hopeful that I think what the alarm that has been raised by some of the treatment centers is valid, it's warranted, and I think we're going to be able to provide some relief working with the legislature and provide some type of outcome that everyone is happy with, and that we're making sure we're providing not just treatment and access to treatment, but access in the rural areas as well. Let's remember, there's 10 counties. It's not just Manchester and Nashua. We know they're at the heart of the crisis in many ways, but when you look at some of the addiction rates in some of the rural counties, it's very high. So you want to make sure that access to treatment, if you're a single mom with 2 kids and you're living up in northern Grafton, are you going to drive 150 miles down to Manchester to have to get treatment? No, probably not. So making sure that rural access to treatment, and we're really touching all the different areas across the state, I think is a big piece of this puzzle, and how that works into these rates is going to be critical.
We're all waiting on the eventual Supreme Court opinion on HB 1264, the voting bill that matches up residency and domicile. Republicans say this is a necessary tightening of our election integrity laws. Democrats are saying this could restrict voting access. Let's look beyond that, though. You've said on just now that we don't need any more gun laws. If this is ruled constitutional and you sign it into law, are you confident that we don't need any more election integrity laws?
Well, again, the heart of the issue for me here is the constitutionality, right? We want to make sure that we're not going against our Constitution, or both state or federally. Remember that all the other states around us already have, you have to be a resident of those states to vote. We're actually the outlier. This law just kind of brings us up to where they are. But there's the constitutional issues to bear, so we asked the Supreme Court to look at it before we went too far. That way it would potentially give us time to fix it next time around before we did something that could be deemed unconstitutional or illegal. So I think we're taking the right process moving forward. Beyond this, I don't have any other election issues to bear. So, my sense is that we signed SB 3. I think that was a good law that gave the Attorney General some real powers in making sure that our system had integrity. This next piece, if warranted by and deemed constitutional by the Supreme Court, I think it would be hard to not vote for it, or I should say sign it, put it into law, and move forward. Get ourselves back to par with all the other states around us.
You're very excited about the transformational economic potential there in the mill yard with the Advanced Regenerative Manufacturing Institute. You just signed into law some tax breaks and incentives for Army. What do you tell the next CEO who comes along and says, hey, I've got a good idea and I'd like to get the same deal that Dean got? It's only fair.
So there's a couple different aspects here. Number one, we're really focused on workforce. And so this student loan repayment program and some of the tax breaks that are being given, what Dean came in and Army have been able to do is take what was initially a small government grant and really triple and quadruple it with private investment. Allowing Manchester to be ground zero for 21st century healthcare, which is the regenerative technologies. I mean, really growing valves and lungs and organs and things so people aren't dying on a wait list for something. That's the old way of doing it, right? What Dean is trying to do is really take us into the next phase of the 21st century, and it isn't just a short time blip. This is healthcare for the next 100 years. I really believe that, and I think that's why so many of the legislatures, folks in the legislature stood up and said this is something we need to do. We're focusing on student loan repayment programs and healthcare workers. We're focusing on anything we can do to drive workforce up here. We're very fortunate in that last year our population grew faster than Massachusetts. First time in a long time that's happened. So we've already made some huge inroads. We got to really find the next piece of that puzzle, right? When things are going well, I always say put your foot on the gas and go faster, right? Double down on your successes. If there are other businesses and other industries out there that have similar needs or whatever it might be, maybe it's something with energy, maybe it's something with workforce. Whatever we can do to help businesses, frankly, get the resources they need, get out of their way, let them do business in an economy that across the country is absolutely booming right now, and we're at the forefront of it. Let's take advantage of it.
So bail reform, you said you intend to sign Senate Bill 556. A lot of county attorneys are on the opposite side of this. They would ask you to veto this bill. We spoke to one who said if this is passed into law, quote, people will be released who shouldn't be released. Why risk the wrong kind of offender falling through the cracks? We sat down and I listened to the county attorneys, and we also sat down with a lot of folks in law enforcement, and overwhelmingly folks in law enforcement really understood that this was the way to go. And if there's anybody that understands who should and shouldn't be released, I believe it's a lot of those on the front lines, the stakeholders, that being the law enforcement community. So, we've looked at both sides of the issue. It's not black and white. I understand that some of the counter arguments, we're not necessarily letting people out of jail that shouldn't be let out of jail. I think that's the county attorneys say that will happen.
I think there's a lot of hyperbole in there. I really do. And again, it's not that we're not listening to it, but there's another side of the argument, and I think bail reform is the way to go.
So the Pretrial Justice Institute is helping to guide bail reform through the courts right now. They recently told the Interbranch Criminal and Juvenile Justice Council that this bill is the first step toward no pretrial incarceration whatsoever. They're advocating for you get arrested, you go right back out. Do you ascribe to that same viewpoint?
Not right now, I don't. No, I mean, if we go, going to the point of no pretrial incarceration, I don't know if that's the right answer, and I'd be very wary of going down that path again without talking to the stakeholders and really understanding what the true implications are.
They say this bill is the key to opening that door, though. This is where they're headed.
Well, we'll see where it goes. I mean, this bill doesn't do that. Let's be very clear. This bill does not actually do that. So I think again, you got to look at the stakeholders. You got to talk to the folks that are on the front lines of this, and you got to everything from the lawyers to the county attorneys to the prosecutors to those that are on law enforcement that are actually making the arrests, that are actually appearing in courts. Talk to the judges. Those are the folks you really want to bring to the table to understand what the potential next steps down the road could be.
So you come back in 2019. Do you want to see another education savings accounts bill at least try to get to your desk?
I'd love an education savings account. Look, the bill that we put together in terms of education savings account affected those of the lowest income scale up to 185% of the federal poverty level. Folks and families that simply don't have other choices and other means. A lot of folks have other means in this state, and they can provide options for their families, and that is wonderful. But we have to make sure that there's equal opportunity. That's what I believe government is all about. It's not about guaranteeing much other than opportunity. My job is to create as many doors of opportunity as possible for you, for your business, for your family, and what you do with it is up to you. That's the live free or die spirit. And so that's exactly what this bill did. It really helped, especially helped folks on the lower income scale. I'd love for that bill to hit my desk again.
All right. Governor Chris Sununu, we'll see you back here hopefully sometime in the fall, I think, just before the election.
We'll be around.
All right.